Something remarkable is happening in hospitals across the world. Bariatric surgery units are getting quieter. For decades, weight loss surgery, also called bariatric surgery, was the gold standard for treating severe obesity. It worked. It saved lives. Surgeons could not keep up with demand. Then came the GLP-1 drugs, Ozempic, Wegovy, Mounjaro, Zepbound. Between 2022 and 2026, prescriptions doubled, then doubled again. And as GLP-1 use exploded, bariatric surgery rates dropped by 25%. Patients who would once have gone under the knife are now managing their weight with a weekly injection at home. The results with GLP-1 drugs are genuinely impressive. Clinical trials show 15 to 20% body weight loss, numbers that were once only achievable through surgery. And the appeal is obvious. No surgery, no general anesthesia, no 6-week recovery, no permanent alteration to your digestive system, just a weekly injection. But researchers are beginning to ask an important question. Are GLP-1 drugs actually as good as surgery in the long run? And the honest answer is, we do not yet know for certain. Mayo Clinic published research suggesting that bariatric surgery may deliver greater long-term cardiovascular benefits than GLP-1 medications alone, particularly for patients with existing heart disease. Surgery physically restructures the digestive system, triggering metabolic changes that go far beyond weight loss. These changes affect blood sugar regulation, inflammation, and heart function in ways that a drug may not fully replicate. There is another concern gaining attention. People on GLP-1 drugs eat far less, and when you eat far less without the right protein intake, you lose muscle, not just fat. This muscle loss can slow metabolism and weaken the body over time. Johns Hopkins researchers note that combining strength training and high protein intake is critical for anyone on GLP-1 therapy. Without it, you may be losing the wrong kind of weight. This is where natural support becomes important. Berberine, a plant compound used in traditional medicine for centuries, has gained serious attention as a metabolic support tool during weight loss. Studies show berberine activates an enzyme called AMPK, the same metabolic pathway activated by exercise and to a lesser extent GLP-1 drugs. It helps regulate blood sugar, supports insulin sensitivity, and may help preserve metabolic rate during weight loss. It is not a replacement for GLP-1 drugs or for medical supervision, but as a complementary support, especially for managing blood sugar stability and energy during caloric restriction, berberine is worth knowing about. Back to the bigger picture, GLP-1 drugs are genuinely transformative. They are making obesity treatment more accessible to people who were never candidates for surgery or who simply feared it. That is a good thing. Obesity is a complex chronic disease. Having more treatment options at different price points and risk levels is progress. The important takeaway is this: if you are considering either path, medication or surgery, have an honest conversation with your doctor about your specific situation. Your BMI, your heart health, your history, and your goals all matter. GLP-1 drugs are not a shortcut. Surgery is not an overreaction. Both are legitimate medical tools. The right one depends entirely on you. For the complete breakdown, including what the latest research says, who should consider each option, and how to have the right conversation with your doctor, the full article is at medimedad.com. Weight loss treatment is changing faster than at any point in medical history. Stay informed, stay ahead. Visit medimedad.com for trusted health news every week.